Hello everyone, our community health project is on pertussis. So pertussis is a super contagious respiratory disease that is also known as the whooping cough. It causes violent and uncontrollable coughing fits that make it hard to breathe. These coughing fits can be so intense that people often vomit or feel completely exhausted afterward. In infants, the whoop sound may not always be present, but the effects can still be very severe. It starts out with the mild cold-like symptoms, but after a week or two, the serious coughing begins and can last for several weeks or even months. So what causes pertussis? The bacterium that causes pertussis is called Bordetella pertussis. It is a gram-negative coccobacillus, meaning that it has a round rod shape, and once it's inhaled, it attaches to tiny hair-like structures on the lining of our respiratory tract. From there, the bacteria releases toxins and causes damage both where they attach and throughout the body. These toxins irritate the lining of the airway and contribute to inflammation, which leads to severe coughing symptoms we see. So what are the stages of the whooping cough? Stage 1. This is the earliest stage and can last 1 to 2 weeks. Symptoms may include a mild cough, runny nose, and a low fever. Stage 2. The second stage may last from 1 to 10 weeks. It is characterized by severe coughing fits, trouble breathing, and a cough that ends with a whooping sound when breathing. And finally, stage 3. The third stage is known as the recovery stage, but it can last weeks to months. The cough usually decreases during this period, but may continue occasionally and can return later. So along with the stages of the whooping cough, I'm also going to talk about how the stages of symptoms manifest. So the first stage, symptoms are usually similar to the common cold. This includes anything from a runny nose, sneezing, mild fever, and a slight cough. The stage usually lasts 1 to 2 weeks, and unfortunately, it is the most contagious phase, even though the symptoms don't seem severe yet. The second stage, this is when the characteristics of the whooping cough begins. Patients experience intense bouts of coughing, often several times in a row without being able to take a breath. After the coughing fit, they make a high-pitched whoop sound when they finally inhale. Vomiting and exhaustion are common, and this stage can last several weeks, even up to 10 weeks. Finally, the third stage, or the recovery stage, is where the cough gradually becomes less severe. However, the coughing fits can still return with future respiratory infections, even months later. It is important to note that infants may not show the typical whoop sound, but can stop breathing entirely, which is ultimately life-threatening and can lead to death. That is why early recognition and treatments are critical. So what is the modes of transmission? Pertussis spreads through respiratory droplets, meaning that it's passed from person to person by coughing, sneezing, or even talking at close range. It is highly infectious, especially in places like schools or homes where people are in close contact. Someone with pertussis can infect others for up to 3 weeks after coughing starts, unless they are treated with antibiotics early. This is why timely diagnosis and vaccinations are so important in controlling its spread.
Some complications of pertussis are secondary pneumonia, otitis media, seizures, encephalopathy secondary to hypoxia, periorbital edema, pneumothorax, and even death. The treatment and management of pertussis, especially in infants and young children, is supportive care. This includes oxygen therapy administered to maintain adequate oxygen saturation, suctioning for gentle removal of secretions to help clear the airway, hydration, whether oral or IV fluids to prevent dehydration, avoidance of respiratory irritants to minimize exposure to dust, strong odors, and smoke, parenteral nutrition in severe cases where oral intake is limited due to persistent coughing or vomiting, medications like antibiotics like erythromycin, azithromycin, or even trimethoprim sulfaçazole for patients allergic to macrolides. There's also corticosteroids that are given to reduce inflammation and severity of coughing. Morbidity and mortality of pertussis. Pertussis remains a significant public health concern globally and particularly impacts infants and children. There are an estimated 24 million cases of pertussis annually worldwide, resulting in over 160,000 deaths each year, emphasizing the persistent global impact of the disease despite the availability of vaccines. In infant mortality, infants younger than 6 weeks are at the highest risk for severe complications and death. A study reported a mortality rate of 34.2% in severe cases, with the majority of fatalities in this vulnerable age group. In the United States, pertussis remains a cause of preventable infant deaths. According to the CDC, 5 to 20 infants' deaths occur annually, with most deaths occurring in babies under 3 months of age before they are fully vaccinated. Incidence and prevalence of pertussis. Pertussis incidence and prevalence have significantly declined since the introduction of routine vaccination, though periodic outbreaks still occur. In the pre-vaccination era, the United States experienced 150,000 to 250,000 pertussis cases annually. Following widespread immunization efforts, the number dropped to 1,000 reported cases in 1976. Despite initial success, pertussis cases have resurged periodically. As we saw in 2012, the CDC reported over 48,000 cases, marking one of the highest annual tolls since the 1950s. As far as age distribution, 38% of pertussis cases occur in infants younger than 6 months, who are at the highest risk due to incomplete immunization. And 71% of all cases are seen in children under the age of 5, highlighting the importance of timely vaccination in early childhood. The epidemiologic triangle is a foundation model used in public health to understand the factors contributing to the spread of infectious diseases. It consists of 3 interconnected elements: the agent, the cause of the disease, the host, the organism harboring the disease, and the environment, which are the external factors that affect the agent and the opportunity for exposure. So in our case, we have the agent Bordetella pertussis, a gram-negative Coccobacillum bacterium that attaches to the cilia of the respiratory epithelial cells and releases toxins that paralyze the cilia, causing inflammation of the respiratory tract. This leads to the hallmark symptom of paroxysmal coughing, and the bacteria is spread through airborne droplets from coughing or sneezing, making them easily transmissible in close contact settings. Our host, which is usually high-risk groups, especially infants and young children under the age of 6 months, those who are unvaccinated or partially vaccinated are at the highest risk of severe complications, including pneumonia, seizures, and even death. Additional risk factors include lack of vaccination, waning immunity in adolescents and adults, and those with chronic underlying conditions. Our environmental factors play a significant role in the transmission of pertussis. Crowded living conditions like schools, daycare centers, or low-income housing facilitate the rapid spread of airborne pathogens like pertussis. Inadequate healthcare infrastructure, limited access to vaccination, and inconsistent public health outreach can exacerbate outbreaks. Seasonal factors may also influence the spread, with increased cases often observed during the late summer and early fall, possibly due to increased indoor crowding and school reopening. What is the nurse's role? As a highly contagious respiratory disease, Early detection, education, and prevention a key, and nurses are the heart of that effort. Case finding. One of the primary responsibilities of the nurse is case finding, and this means actively IDing the individuals who may have pertussis through health screenings in schools, clinics, and community centers. Early detection helps prevent the spread of the disease and ensures timely treatment, especially in high risk populations like infants and unvaccinated individuals. Reporting. Pertussis is a reportable disease, which means that once a case is suspected or confirmed, the nurse must report it to the local health department. Accurate and timely reporting is essential for public health surveillance and allows authorities to initiate broader prevention and intervention measures to control outbreaks. Data collection and analysis. Nurses are responsible for collecting and analyzing data related to confirmed pertussis cases. This includes gathering details like age, vaccination status, symptom onset, and contact tracing. They also assist in analyzing this data to detect patterns, identify affected groups, and support public health decision making. Lastly, the nurse plays an important role in follow up care. This involves checking in with patients and their families after diagnosis to provide education on preventing transmission, monitor symptoms, and ensure proper use of prescribed antibiotics. Follow up helps reinforce health messages and supports recovery while reducing the risk of further spread. Nurses are vital in every step of pertussis management, from identifying cases to reporting, analyzing trends, and providing follow-up care. National organizations play an important role in the fight against pertussis. First, the Center for Disease Control and Prevention, or CDC, provides evidence-based guidelines for the prevention, diagnosis, and treatment of pertussis. These guidelines help healthcare providers make informed decisions and ensure consistent, high-quality care across the country. The National Foundation for Infectious Disease, or NFID, plays a major role in educating both the public and healthcare professionals about infectious diseases, including pertussis. They organize awareness campaigns, publish reliable resources, and offer continuing education to support best practices in prevention and treatment. Finally, local departments, with support from the CDC, are on the front lines of outbreak control. They receive funding, training, and technical assistance to carry out effective immunization programs and public health interventions in their communities. Together, these organizations help coordinate a national response to pertussis, supporting both prevention and timely treatment to protect public health. In summary, prevention is critical because this disease spreads easily through coughing and sneezing. Vaccination is the most effective method to protect individuals and communities, particularly through the DTaP and TTaP vaccines. Maintaining high vaccination coverage, early case identification, and public education are essential to control outbreaks and protect vulnerable populations. Preventing pertussis not only saves lives but also reduces the burden on healthcare systems and keeps communities healthy and safe. Thank you for listening.